we may be scraping shoes to demonstrate here is the dirt that's on her shoes. This is the same dirt that is at the place where she said she was assaulted. And then we may or may not collect controls depending on what our options are. And that's where you're collecting something to show what that area looks like without any alteration by the assailant. So without any body fluids, and it may be skin, it may be standard DNA controls from the mouth if there was no assault of the mouth. So again, it may be that we're not able to do controls at the time of the initial assault, at the initial assessment, but that we may need to have them come back in 3 days and collect controls. It may also be blood controls depending on whether or not there's any blood that we've collected. One of the things to be aware of is that right now we will collect up to 5 days. We've just recently increased that from 3 days. And many of us have found viable DNA 7 days out. So you may see somebody who is rigidly adhering to the 3 days because that's how they were trained 15 years ago. And you may see somebody who a month out is going to go ahead and collect DNA from the vagina. Be aware that patients come in with what we call the Csi Effect, and they believe that we're going to do everything that they see on CSI, that they're going to have the results back while they're in the emergency room, and indeed the police will solve the case within an hour. That is not true, in case you had any thoughts regarding that yourself. And for DNA, that determination as to whether or not they're even going to run it is made by the law enforcement and or prosecutor. And so that may occur even months later. And sometimes it will interfere with medical exception to hearsay because they have gotten way too much information from TV. Medical exception to hearsay means that I'm allowed to take what they said and say it in court and enjoy hearsay exception. So I can say, when I asked this, she replied, quote, this, and this, and I can say that in court, and the jury has to take it as if she was saying it herself. But if she shows too much information, then hearsay may be overridden and thrown down. The basic principles that you should expect to see is that there will be collection, and the crime lab prefers us to use wooden-tipped cotton applicators or swabs. It used to be that we used gauze in a lot of stuff. So again, if you've got somebody that was trained quite a while ago, you may see them swabbing skin with gauze pads, and that's not what the crime lab wants. Again, if you're going to try to use it as an educatable moment, do it out in the hallway. Okay? Then you should be expecting to see some sort of preservation, and the most common form of preservation is going to be drying. This is a standard drying box, and it has a swab container. Now, we've just, within the last year, been told by the crime lab that they don't want airflow through here. This is electronic, and it will blow filtered air, and that's nice. However, they don't want us doing that anymore. Again, you will see people that crank that on and will blow. Okay. Once it's dry, and it has to be dry within 3 hours, or we have to freeze it or refrigerate it. So if we have the wet sleeping bag, because she was assaulted while camping, we're not going to get that down sleeping bag dry. We have to get it turned over to law enforcement and into the evidence collection center within 3 hours so that it can be refrigerated and ultimately frozen. There's a lady down in ours for Snohomish County that still hasn't forgiven me for the wet down sleeping bag because of how much room it took up. You're going to see a package, and we package, and you have to have a minimum of 2 layers of packaging. So usually there's an inner something, a box or a bag, then an outer something, another bag or an envelope, And then there may even be a transport, then certainly the rape kit that we have, which is standard for Washington State, okay? There's going to be documentation. There has to be labels on everything, what we collected, how we collected it. Then chain of custody is very important. Now, it's really important that you not touch evidence. So it's not uncommon for the patient to come in and they've got this plastic bag with all their clothes in it, and the first thing all they can think of is, I have to give this to somebody. I recommend that physically, don't be polite. Don't say, oh, okay, I'll take it and I'll set it here, because you're going to be put on my chain of custody, because I will ask, how did this bag get from the patient's hand to that counter? And if the answer is, oh, she handed it to me and I put it there, you will be on the chain of custody, and it is highly likely that you will be subpoenaed, okay? And we don't want to get into any sort of precedence where people think they can always subpoena the advocate. It's not good practice. So don't take it. I will see advocates, and I train our advocates to literally step back and put their hands down and say, you know what, I'm not allowed to touch it, or I don't touch it, or whatever words you'd like to use. Could you put it over there on the counter? As long as it stays in the room with the patient, that's chain of custody, because it's in her possession. Then when the nurse gets there, then we'll formally take over possession and separate everything out and get it all packaged and labeled, right sock, own package, left sock, own package, all that kind of stuff. So don't touch evidence. The other thing is that often a patient will give a urine sample. The ER knows that we may or may not want the urine, so if the patient has to go to the bathroom, they'll just give it to them. They may come out, try to hand it to you. Again, no, put it on the counter, please. If the ER nurse removes it from the room, we can't use it. Okay, so it just sits on the counter. The chain of custody form is a form that is commonly used to show I had it, then I gave it to this person, then I gave it to that person. So for us, normally it's I got it from the patient, and then I put it in our lockup, and then the next documentation is usually from my medical assistant, who then says, Detective so-and-so came and picked it up. It's a multi-part copy. One of it goes with police, one of it stays with the charge. Okay?
Can I interrupt and ask a question? Because we get this question a lot. When you put it in lockup, how long can it stay?
If it's been dried properly,
yeah,
it can stay indefinitely.